Welcome to the Cut the Fluff podcast. Now, we've started this podcast because we know how confusing it is to navigate pet ownership. And we're here to give you that insight you need to help you path the right way for you and your dog. In this episode, I'm bringing Roxy, a qualified veterinary nurse. Roxy's had over 19 years experience in the veterinary industry. She studied at the Royal Veterinary College and she's worked for the likes of Fitzpatrick. So stay tuned for some tips and advice that you can do with you and your dog every day or every week. And just keep watching to find out more. So, Roxy.
Hello.
Thank you for coming.
Thanks for having me.
I can't wait for this conversation because Roxy's been in the veterinary world for 20 years.
20 years.
And you are a registered veterinary nurse?
Yeah.
By trade?
By trade.
But then you're also now developing a veterinary practice, aren't you, in London?
Yeah, so I practice manage a veterinary hospital in North London, emergency.
Amazing.
Yeah.
Okay, so 24/7 A&E type.
Yeah, also do general practice stuff as well.
Okay.
But yeah, our specialism is emergency care.
Amazing. Okay. So what do you tend to see from emergency care? Like, is it injuries? Is it what sort of a lot of the clients that come in, or could it span from everything?
It's literally everything from trauma cases, car accidents, to chronic illnesses, to picking up disease on the heath, and it's everything you can possibly think of.
Yeah.
Orthopedic, neurology, ophthalmology.
Yeah.
Everything. Yeah.
Keeping you on your toes.
Absolutely. It's very busy.
So what are you doing at the moment as your day-to-day, if it's not sort of hands-on now? What's your kind of focus? What does your day look like being in Roxy's world?
Oh, well, it's more of like looking, not only just managing the financial side of things in the business, but it's making sure we've got the right skill set for what we're seeing in. So making sure our vets are upskilled and supported, our nursing team, we have enough numbers and that they've got the right skill set to go to continue with the day. So like we do a lot of anaesthesia as well as like hospital-based care. So making sure everyone's got what they need to be able to do the job so we can provide the best quality care for our patients.
Amazing.
Yeah.
And you've worked at Fitzpatrick as well, haven't you?
Yeah, so I did 6 years as a nursing manager there, which saw mainly based on orthopedics and neurology. So we saw a lot of Daxies with their spines.
Yes.
And a lot of Shepherds and Labradors with their hips. And the trauma cases that come in too with broken bones and things. So that was a very different from what I'm doing now, but an amazing experience.
And did you see, so obviously Fitzpatrick, very, very talented man.
Yeah.
Did you see kind of how that developed over time, the surgery and what he brought out, and the cases that you're able to kind of fix now is incredible. If you take it back to when you started, you studied at Royal Veterinary College, didn't you? Is that? So you can see how the technology's developed as well, and we're replacing dogs' legs and everything, really.
Yeah. For the biggest things are seeing dogs with osteosarcomas or bone tumours and things, and the options are previously used to be remove the leg, and then
which is really stressful,
and then go through chemoradiography and radiation and things. But now, at Fitz, what he did was make endoprosthetics, so created bones within, so metal bones as a limb, and creating feet for them. So like one of the biggest stories that we're known for was the cat that went through the combine harvester and lost all his limbs.
Really?
And we created little legs
horrendous.
And little feet. I know, which usually, I think back in the day, you'd think a cat in that much trauma,
you wouldn't
put to sleep, or they can't deal with that more than with just 2 legs. So that gave that cat a chance to live again happily. So it was quite innovative and new, and that's what I think Fitzpatrick's is known for. But it helped us understand disease process and what we can actually do, but balancing, is it the right moral thing to do versus
that's the hardest part, isn't it? Because that as owners, I feel like we can be quite self-focused when we're trying to kind of eke our dog to live a little bit longer, or our pet, because it's for us, like it's for our sake, but actually there is a balance of and only you can decide that as the owner because you know your pet so well, but also you can seek the veterinary advice of what they think, and that's where you guys come in really valuable as a team to kind of outside perspective, focusing on their well-being and welfare versus us that bring the baggage into the room. We're emotionally charged and kind of want to be self-focused in that sense and keep our pet with us. So
and we've got a professional responsibility to give options to clients and say this is what your options are. We can't really sway one way or the other because it is down to the client, but here's your options, but here's the outcome, the possible outcomes of this, and this is what your dog will potentially go through if they went through that surgery. This is the time it takes to recover, and you as a client need to balance that out and make that decision, and we can only just guide.
Yes, love it. Well, it's not the easiest job.
No,
really not the easiest job.
It's emotionally charged for us as well as veterinary professionals, and we obviously have to maintain that professionalism. But with my team, I don't like that kind of clinical way of thinking where you're just, people's pets are part of our lives every day. So we cry with our clients and we learn to love their pets and we love seeing them and we just want them to be better. It's the whole thing is just super emotional, and that's why I'm doing it.
Yes, I love it. And I guess also you get to know that client, like you said, but you also, a special gift is you see the dog probably sometimes from a puppy to all the way to senior, and advising those clients on what to do, because when you get a dog, every single dog, I would say, and this is every pet really, is different. So like as a trainer, I have not, there's not a one size fits all process. Same with medical, you're in a different circumstance, you're living in different areas, affordability comes into it, what can we feed our dogs, and it's also breed. And I know you said earlier when we were chatting through this, breed is a really important aspect that we need to, as owners, look into more. We fall for the kind of clickbait, oh, that dog's really good looking, or I've seen that dog on an advert and it looks cool. But I guess from your perspective, do you mind telling us a bit about choosing the breed and from a medical lens and your veterinary nurse experience, what the most important parts are and what we all need to be aware of as owners?
That's a really big topic, and what you touched on was what things are being advertised, and people are like, that dog's really cute. But what you'll find is, like the Cavalier King Charles Spaniel, for example, that didn't used to look like that 100 years ago. It was developed so it had bigger eyes and was super cute and always looked like a puppy. But with that comes genetic predispositions to have heart conditions, eye issues, something called syringomyelia, which they get. So they come with health issues too. And with what I'd say to people if they're picking a puppy, don't go on looks, go on temperament of that dog's style, personality, and how that fits in with your lifestyle. It's so important to do that. And I did that. I love German Shepherds. Love Shepherds. But for my lifestyle, I thought that's not going to work for me. So I've got a golden retriever that comes to work with me in London every day. Like,
does your dog come to London?
She gets on the underground, 6 years a puppy, put her in a little bag, and she comes and she loves it. And she's for an environment like that I'm in, she loves that. But if you bring a highly strung, anxious dog into a situation like that, it's not going to work. So,
and with drive as well, drive's a big one that us trainers go on about. I guess it's like you've got a dog with drive, it's not going to be relaxed all the time. No. It's the same sort of
And then you get a dog that's stressed and ends up seeing behaviours trainers and trying to figure that out when probably the environment isn't right for that dog. And then long-term stress in animals, both cats and dogs, leads to chronic disease, and that's a big link between that. And it's our responsibility to make the right choice. But
it's like us, we age with stress. We're like,
absolutely.
Us females don't want to stress. We don't want to age.
Never. So all the cortisol that runs through the body, it does have an effect. Like with humans themselves. And like cats, for example, you don't see they're stressed. We're taught as professionals to know how that looks and that presents in a cat. But long-term stress of cats lead to chronic kidney disease.
Wow, I didn't actually know that.
There's a lot of that.
If you see, obviously we're dog focused, but for now, cats, what does stress look like in cats?
Stress in cats, the way that or where they urinate, Their body behaviour, they could just be sat there, and where their ears are turned a certain way, you can go, and how it's expressed. And there was a story when I did my behavioural section of my training, was that a cat that we had at home was urinating everywhere and then refused to go out and refused to eat, and used to sit in one place in the house all the time. And it turns out it's because there was a cat sat in the garden just staring at it every day, and that was enough to drive that cat so unwell it had kidney disease.
Oh my gosh, really?
Yeah.
Wow, that is something I didn't know. So no, it's really interesting. So if we go back to choosing breeds, flat nose breeds, what do we need to look for? Because obviously there's a lot of flat nose breeds and little dogs that we choose to suit our lifestyle, but there is some things that we need to be aware of when we're choosing that sort of breed.
Yeah, that's a big point at the moment, because obviously French Bulldogs, Boston Terriers, the short faces, even down to boxers, they're what we call brachycephalic, short noses, and short soft palates. They come with a lot of health issues. So I know we touched on, we've spoke before about French Bulldogs. They're super cute, really sociable, lovely little things. They can go everywhere with you, but their inability to be able to breathe properly, they get excited. Exercise is an issue for them if they over exercise. Heat is a massive one, so they can get to a point that they can't breathe or they exert themselves so much that they can faint and sometimes die. And what those breeds need is early intervention and to test the severity of how bad that is. So there is procedures we could do to kind of correct and like open up airways for them so that they can breathe better. So if you're going to select a breed that what we call brachycephalic or short nose, make sure that you do your research with that, because it's super important. See what, it might not have a long life, what you expect. And bear in mind the procedures that you may have to go through to extend that dog's life.
So say I had a Frenchie and they were being sick and lying down a lot on a walk, what would you say as the owner? What would you suggest I did?
Well, I'd say it wasn't normal. I would say definitely go and speak to a veterinary professional. And kind of gauge with it, have a chat with them about exercise, feeding, when you're feeding, when you're exercising, how long for, what you can do at home to help a situation. So for Frenchies in the summer, don't walk them outside. Keep them very short, or walk them early in the morning or late at night. Keep cool mats down, access to water, and keep them calm. But that's not always going to suit everyone that wants to go out on a nice summer picnic and bring the dog. So that's a toughie.
It's definitely something that we need to consider, because I would love to do a little kind of dating matching service for dogs and owners, because I feel like we need it. Like even attachment style, personality trait. A red flag for me is if an owner says, I bought this dog to make me more active. I feel like, yes, they can give you that structure and they can hold you accountable, because they will remind you if they haven't been out. But if you're not active, don't buy a border collie. That's kind of where we're at. So I think researching from a health lens as well as from a lifestyle lens is so important. And I think we all need to be aware and just be curious, because we might love the look of an Australian Shepherd, but does that match our lifestyle? Things like that. Is the dog aloof, or are we rescuing from abroad? Have they got kind of guardian instincts in them? You're going to get a very different personality type to the dog you want to bring back to Surrey and just chill in a Surrey Hills house.
Yeah, exactly. And then it ends up being some people can't cope with these dogs, and then they get put into homes, and then you'll see, behavioural issues because they've been put into a kennel. And then it's trying to rescue them and then rehabilitate them to normal life again. And no one likes seeing dogs in the RSPCA like building up, and we're running out of space for all of that. We need to be more responsible when picking.
Definitely.
They're for life, not for Christmas. And that is literally
I know.
So true.
And they mould you like, oh my gosh, the Mally that I've got is like next level, and she wouldn't have necessarily been my choice. But there's a totally different drive to a German Shepherd I've had all the time. So like, it's so interesting. And my poor German Shepherd hasn't come with as many brain cells as that Mally. So she bosses him completely. But I think just even to see that, and I'm aware and I'm a trainer and I'm used to these sorts of breeds, but even that with a busy job is very hard to manage. So
yeah, I can imagine.
So from a health perspective, what should we be doing for our dogs to prevent instead of always cure? Because I feel like I had a veterinary nutritionist on previously, and it was again how we feed our dogs, and we've only got a short span because they don't live as long as us to figure it all out and make sure we're making the most of our dog and lengthening their life where possible.
Yeah.
So I guess from your veterinary nurse side, how can we help our dogs be in the best condition possible? And what does kind of like a good ownership look like? And what sort of routine should we get into with our dogs?
So I would say always keep in touch with a veterinary professional.
Yeah.
But kind of like you mentioned about the lifespan is shorter than humans.
It is.
Picture your, like, I've selected Bambi as my dog, my golden retriever.
I love that name.
It's so cute. But knowing that she'll probably live 10 to 12 years,
yeah,
if I'm lucky.
Yeah.
So kind of picturing what I need to do at the start. As a puppy, what do I need to get that puppy healthy to grow to adulthood? What do I need to maintain during adulthood to keep them healthy and safe? And then senior years, completely different ballgame as well. So I'm sure the nutritionist spoke about high protein diets for puppies. The puppy diets and kitten diets are different.
Yes.
They have different requirements for growth. And regular weight checks, making sure. I think my biggest thing is keep your dog slim.
Yes.
Keep your dog slim. They last longer. A bit like humans. If you're overweight, you're predisposed to diabetes, joint issues, everything else that goes wrong.
And so when we say slim, is there any indication on when you think your dog's the right weight? Can you feel it and go, a little bit overweight here? So I've been told if you can feel the last two ribs, this may or may not be correct, you can correct me. If you can feel their last two ribs, they're kind of in the right span of weight. But is there anything that owners should be checking other than going into the vets and weighing them regularly?
Yeah. So yeah, you don't have to put them on the scales all the time. What we do is look at a body condition score, we call it.
Yeah.
And you can Google pictures of that. Okay. And you can have there's like a guide and shows you what it looks like. But for feeling, what I do is, you should be able to feel the ribs from the outside. And if you look down on your dog, they should have a sexy waist.
So sexy waist. There we are, guys.
Sexy waist.
Yeah. Okay.
So they're sexy waisting. They are in a good
you're
position.
looking for that curve into the waist and then out again.
If it's straight, you're overweight.
Okay.
And you can look at people do think if they're straight that they're perfect.
Yes.
But it doesn't work like that. And I think if you keep them more on this, not underweight obviously, but on the skinnier side, you're going to have there's a lot more leeway in terms of feeding and exercise. But you're better off on that side for health issues.
Yeah, definitely. And I know that I harp on about that as well, because from a training perspective, you've got dogs that just don't want to work for anything really, because they can take it or leave it. You know, what's my reward? It's like us going to work, getting a salary. Our dog's going to have access to food all day long. They have no drive then. There's no motivation. Yeah. So it's the same thing. So I think that even knowing that and being able to check for that is really, really important. And my neighbour avoids me at the play because he knows that he's overfeeding his dog. And he'll go, Katie, he's put on a bit of weight. And I'm like, yes, I know. So I think that's really, really important. And it's something that is really easy to overfeed because you feel guilty.
So easy. When the dog sat next to you, looking at you eat your dinner, like, oh, but he loves a gravy on top of his dinner.
Not gravy.
A bit of chicken or something. And you're like, the equivalent is mental. Like in a lot of veterinary practices, and you'll find it online, there's like just a cheeky biscuit. The equivalent of giving that to a dog is the same as like eating 3 burgers for us. And it's just got to stick with the food, measure it out, assess all the time, have a look. Sometimes we need to feed more or feed less depending on the level of exercise, time of the year.
Yeah.
We just have to be on it, and that is probably the single most important thing that we could do without going to the vets, that we can secure a healthier life for your dog.
Yeah, but no one teaches you these things. Like,
No.
even us as humans, like learning about diet, and if I'm on the go and trying to find something quick and healthy, you think it's healthy and then it's not. And it's exactly the same with the dog. You think you're doing best by them by giving them that really nice treat because they don't live long, and you want to be that nice owner and not have mum guilt or dad guilt.
Yeah.
But actually helping them stick with the food, or give them treats and weighing their food out so you can actually replace, you know, those calories, so you're not giving them extra calories, is the best thing to do by them, isn't it?
Yeah, and if you start that young, like they're not going to know what they're missing out on. They don't know.
Yeah, that's true. But we do. So then it's that emotional, like, oh, I haven't taken you here, or I haven't given you this. So yeah, no, I think the exercise bit I found really difficult to gauge, because I started running with my Mally, and then I was like, oh, she's a little bit overweight, and then, oh no, she's got really trim now, and just like kind of managing that. So food brands that actually do that for you really helps as well.
Yeah.
But yeah, going into the vets and actually getting them weighed, and also we'll include that guide down below, would be amazing, just to sort of, so you can keep in check and make sure that you're keeping your dog as healthy as possible.
And I suppose the good thing about going into the vets, that you're not doing anything bad with them. You're going in, you're sticking them on the scales, they can update the weight for you. It gives them a pleasant experience when you go in. So if they are unwell and ever need treatment, they're not scared when they go in. It has to be part of
it's their happy place.
Yeah, it's a happy place,
scary
too.
place. I mean, we're all scared of something, aren't we? Like
no one likes the doctors, do they?
No, or dentist. I think people don't like the dentist. And it also equals in our mind bill. So it's like pound signs. And I know before we sort of got on camera, we were talking about that as well, in terms of our mindset with health checks and taking our dogs for health checks. Can you tell us a little bit about that and your thoughts on it all, really?
Yeah, the veterinary industry, I think at the moment as well, has got there's a big question mark around pricing, and this is what we associate vets with. Oh, they're too expensive. But what they're not seeing, I think the problem is maybe some vets aren't showing the owners what value they get from doing that. So what we were talking about was, if we go to the doctors, we don't have to pay, we've got the NHS. But they would soon see the difference of that. No one would go to the doctors if they had to pay that.
Yeah.
And the same as in America, I suppose they have insurance. It works differently. So they're insured so that they can go whenever they need to. So it is a bit of a deterrent to go in and get these checks done. But it's a must have. Like, if we didn't have insurance for our cars, like, we would have to pay out a lot of money for, like, if you ever had a scratch on your car and it's like hundreds, and it's like, it's a bit of pain. And you don't see that value because you're thinking of pound signs. But that's why it's super, super, super important to have insurance.
Yes.
Have to have insurance.
I mean, I can talk firsthand about insurance because we've had a German Shepherd with hip dysplasia, and he's now worth about 25,000, I would say. He was a rescue. He came to us with severe hip dysplasia. We weren't aware at the time. We saw loads of behaviours that weren't great. And we had insurance, luckily, and it saved his life. So I know insurance is another monthly cost. I'm actually someone who also pays for my own health insurance just because it's such a big priority of my list, but we all have different priorities, and sometimes we can't afford that. Like, it's expensive, this world. So I guess, how would you juggle kind of having insurance or not, and being able to afford it? And if you're in a position where you're finding things difficult, what can you do? Can you put some money aside for savings, or is it insurance, like, there's kind of, you need to go to different insurers and see what the level is as well, isn't it?
Yeah. So, some people, I think everyone probably has a different opinion on this, but this is from my 20 years.
Yeah.
Is do research and have a look at what a good insurance is, but don't pick it from the amount of money that you spend a month. Because my dog's insured for £20,000.
Okay.
And I pay about 60 quid a month for her.
Okay.
And it is the best money I could spend. It's that peace of mind, because as we were mentioning earlier about, you know, picturing your dog's lifespan, and we want to keep them healthy, we keep them here as long as possible. For your dog, for example, if someone wasn't insured, spending £20,000+, I couldn't do that at all. Nobody, no normal person could afford that.
Yeah.
So that would be then having to make a choice between that dog doesn't have 2 hip replacements, so you manage it cheaper by just by like pain relief, like hydrotherapy, other things to keep them as comfortable as long as possible. But then that dog would probably more likely to be put down earlier because they're in pain. So what has happened is you had the option of being able to have insurance to pay for a big surgery, but has extended the dog's life. And that's what it comes down to. It's the peace of mind. Say, like if we had to insure our children, like we'd do it, they're our children, so we have to put in everything we can, and it's a level of responsibility I think everyone should have as a pet owner. And I don't know why I'm obsessed with car insurance today, but it's a good like
it is
comparison.
To relate to
like what was my point with that about insuring? Went back to cars. I can't remember.
Well, we don't have car insurance, obviously legally we have to. It would be, we would feel the pain, wouldn't we?
That was it. Legally you have to have car insurance. I think legally as a pet owner, you should have to have it. And then we wouldn't have as many problems. We'd have dogs living longer.
Or the rehomes as well, because half the rehomes are the fact that unfortunately owners can't afford the treatment, which is heartbreaking, and I can completely empathise with how much it costs. And you know, we're in a position where everything's really tight and it's hard to afford everything at the moment. So actually it breaks my heart when people have to let their dogs go or put them into rescue because they just physically can't afford to pay to keep them in a good state. So I mean, Max is a rehome of ours, and he's had that double hip replacement, and without that, I don't think he'd be alive today. It just wasn't a choice. The bone was on bone, and he was in agony, and he would scream. So there just was no choice. And now, happiest dog ever. Great behaviour. We're still working on some of the training, but we're playing catch up really. But you know, he lost about 2.5 years of his life in pain. So it kicked in. He was lame from 7 months. So it kicked in really early. It was really hard, but it was the best decision we've ever done. And the fact that we could do that and make a choice, because previously there wouldn't have been a choice. The fact they can do a hip replacement on dogs now is incredible.
It is mental. And a good point to make on that, I think, is the avoidance of going to the vet because of price. Me moving from being a clinical nurse to the business side of things, I have oversight and I see the costs. I see what it's like to run a hospital, to keep our team paid, to keep equipment up to date, to order in drugs
as well.
24/7 is so expensive. But I think the general population's perception is vets get paid loads of money. I'm telling you now, they don't. I know people that work in Tesco's on more money, but we do it because we love it. We don't do it for the money. None of us get into the veterinary industry for the money. We live and breathe animals and wanting to save them and make them free from pain. And that's the oath that we sign when we register. So it's just a good point to make in terms of perceptions of cost.
I think also your guys studying the hoops you have to go through to study. And I mean, I know vets are really educated over doctors. So the fact that that's kind of what you've got to reach that level is just a commitment in itself, to have to study and to reach that. And vets are amazing, and so are the veterinary nurses, because to have that level of knowledge, especially for a broad range of animals, it's not just like the human body, it's a lot of animals. So it depends obviously where you're going. I know there's specialist hospitals for like horses, but it's an incredible thing. So I guess if we're trying to prevent anything happening to our dog and trying to not just leave it until we have to have that serious surgery, or we have to treat something, or we've missed cancer in our dogs because we've ignored the signs. What would you say is the best thing to do, and how do you look for kind of health conditions at home? So are there any tips from your side for owners?
Yeah, I would say what we tend to do is like a nose to tail little examination at home, which you can do, is starting from the nose. Looking at the teeth. Yeah. Looking for signs of tartar that builds up, because dental disease is a massive thing.
Oh my gosh, yes.
Such a big thing. So you could look at the teeth. If they're perfectly pristine or white, no inflammation on the gums and brown staining, we could prevent it from getting worse by cleaning the teeth at home or offering certain chews that help do that. So you can look at that.
I was actually going to ask you, should we be cleaning our dog's teeth on a weekly basis, or like what does good look like, or does it depend on the dog and the food as well?
Yeah, I suppose it depends on the dog, because like Bambi, I could do anything to, she'll just sit there.
Yeah.
Some are more difficult, but also some dogs are predisposed to dental disease more than others, so no matter what you do, you're never going to get great teeth. Poodles, Yorkshire Terriers, they're just bad teeth, but maybe you can delay it by doing it. So as much as they would tolerate, and if they're making it, like you have like fish toothpaste and stuff, some dogs love it. Yeah. If they enjoy it, do it every day. If they don't force them to do it, but keep an eye on that. So
as a trainer, I do teach that, so it's something you can kind of make a happy experience. But
so then they get to the eyes. You can look at the eyes, and like in humans, if you've got, you could tell if you've got conjunctivitis, and you could tell if you've got inflammation. Eyes are super important, because if you have like ulcers and things, they develop very quickly, and they have to be treated very, very quickly. So if you're looking at your dog's eyes and they look healthy, you're golden. If you notice that the eyes closed a bit and there's weeping and conjunctivitis looking gunk coming out, or you can see maybe a scratch on the eye, then you're like, need to see someone about that quickly before it gets worse. So you can, you've noticed that at home by doing your check.
Because the teeth also link to the eye. So sometimes I saw the decaying of the teeth was going as an eye infection. So it's all sinus related.
Yeah, and also because your mouth is obviously full of bacteria. You have abscesses, like lots of plaque, and you have infections and things. That bacteria sits in the mouth. It also, like you say, tracks through, and to extreme levels. The bacteria moves into the bloodstream, and you can get things like endocarditis, so inflamed hearts and things. That's end stage, but it is worth like noting how far it can get.
Yeah.
And it's painful.
Yeah.
Toothache's horrible.
Yeah. Oh my gosh, yeah. People with toothache. I mean, my mum's just had toothache and she's in agony.
Horrible.
Agony. I've never seen anything like it. So if our dog has like, I call it sleepy dust. If our dog has like too much gunk coming out of our eyes and we're wiping them every day, is that a red flag?
Yes and no. Some dogs naturally just have them there, but have like gunky eyes there. I would do like salted, boiled, cold water, bit of cotton wool to keep that. No, I'm not a big fan of like the wipes that come with all the chemicals on. I try to keep as natural as I can. Just some dogs and cats just build up naturally, but if the rest of the eye looks okay and there's no squinting, no redness, then you're probably okay, and just monitor it. And then if it's like happens once a week, or is out now happening once every day, I think, there's a change there. So just make a note of that at home, and just keep an eye on it that way.
I love that.
Silly puns.
What about, I know we're working down to the body and I'm skipping a bit, but I've seen claws really bad. And I know obviously groomers do claws, but I can see them to another level where it needs to go to the vets. If we leave our dog's claws, or is there anything that we can do to help take them down a little bit at home? What are the implications of doing that?
Well, I would definitely say if you have the dog from a puppy, start with the holding of the feet and get them used to it. And maybe you not even need clipping, but get the clippers out and pretend to do it. Maybe some of them will let you file them when you're sat on the sofa.
There's
just
those
give
scratch
it a file.
pads, isn't there?
There's little pads like that. Pavement walking as well. Just having that because obviously we want to take our dogs to fields and all nice places, but make sure that you integrate some pavement walking, because it does.
Yeah, and for training, it's perfect for loose lead walking. So I'm all about the pavement walking.
Yeah. Yeah. And when they get overgrown, it is painful. I've got a funny thing about nails and fingers. I hate hurting my fingernails, and I've got really weak ones, and I know what that feels like to be painful. But they can get to a point that they either curl round, which they need doing regularly, or they need to be walked more. But they can get nail bed infections. And sometimes they overgrow so much that they can split.
Yes.
And splitting of the nails is horrible. And that will require, like, not only is it painful, but we'd have to think about pain relief, like a sedation or an anaesthetic to make sure that we have to like whip them off and start again, and then think of like sometimes if the nail bed's completely exposed, we may need to take the nail off and then like soak it and bandage it, and then it's horrible. And then there's it's for owners, it's a constant doing it every day.
Maintenance, isn't it?
Yeah.
Okay, so then we skipped. Well, I went straight down to nails.
Specific breeds, spaniels.
Yes.
With long ears, anything with long ears, check regularly. I check my dog's ears daily. She's not a spaniel, but I do check it.
Yeah.
Keeping them clean.
Grass seeds as well.
Oh, grass seeds are a big one. Yeah, and they migrate and they cause all sorts of problems. But when you're doing like your daily checks, weekly checks, use that cold boiled water, a bit of salty water, and then a bit of cotton wool. Keep the pinner, the big bit of the ear, clean. Go all in there. Start when they're young so they get used to it. No cotton buds.
Yes.
Don't do that, because you can damage your eardrum.
Yeah, eardrums, yeah.
So just get used to them getting cleaned out. If they don't get cleaned out, it builds up, and then you get the infections, and then those infections travel down past the eardrum. And if it gets to the inner ear, you'll have problems with, vestibular problems. So they like head tilts and they can feel dizzy, a bit like the same with us.
Yeah, horrible. It's like allergies as well, I think is a big one. Our shepherd struggles with ears, definitely from allergies.
Yeah,
so. But that's another thing in itself, isn't it?
It's another huge thing.
Yeah.
So keeping the ears clean?
Yes. Okay. And do you do that? So you check your dog daily?
Yeah, because she's on the sofa with me every day, just sat there. So while I'm here,
you can check.
I'll be like, oh, they're dirty.
That's a good tip.
Looking out for over scratching.
Yeah.
Rubbing their ears on the floor.
Okay.
It's usually a good indication, which you can pick up issues at home.
Fine. And then would you clean only when they need to be cleaned?
Yeah.
Okay.
Yeah. Don't overdo it.
Yeah. Yeah.
No need.
And then I guess also coat, because a big thing is brushing, and we're guilty, including myself, of not brushing enough, I would say. What would you look for a sort of healthy coat, and how do we keep that in good condition?
I guess that depends on breed as well, because the hair is so different.
Yeah, it is.
Like retriever's easy, you don't really have to brush a lot of that out of it. And you obviously need to look for a shine, like a nice shine, but that then is related to diet.
Yeah, not too oily.
Not too oily. If they need bathing, do it. No dogs need to be regularly bathed just for no reason, like how we do. But if they get dirty, bath them.
Okay.
So with Bambi, when we're going to she likes to jump in the most disgusting things.
Retriever, yeah.
Rank. And she smells like a swamp.
Yes.
And I will wash her for that. Because obviously the bacteria pick up and it will sit and it'll go to the skin, and then you get irritations and then they're itching. So it develops further. So I make sure that I just wash when they're dirty, and then they're self-cleaning most of the time anyway. So we don't have to overdo it. But a healthy, shiny coat is always good.
I think if your dog smells too like dog, obviously there's a smell, but with Max's allergies, we went through where he was really smelly, and that was telling us something.
Yeah.
So it's the same thing. Like if you're walking in and go, oh my gosh, my whole house stinks of dog, is that because they're stressed and they're sweating, that sweaty dog smell, or is there something going on and it's not quite the smell that you're used to, I guess?
Yeah.
So.
And I suppose that feeds down to like the skin side of things. Is there a yeast infection there? Is there some dermatitis or hot spots that dogs get in the summer where you can't see them because they're under the coat, And then once you start having a look and going through, you'll see hot spots or itchy spots, and they become infected. Then they start to smell. So if the smell changes, then definitely a good indication at home to be like, oh, something's not right. But I suppose the other side, if you over clean them, then they lose their natural oils and become dry. Then they get dry, flaky skin. Then they start itching. So it could be like one extreme to the other there.
We always want to like use products, don't we? And there's like doggy deodorants now, and there's like nice smelling things to de-dog. But you can overuse those, can't you?
Yeah, absolutely. Yeah, try and pick all the natural things. Yeah. Which is what we want to do for us as well. Like deodorant's bad for us now.
I know.
So, the chemicals and everything.
Oh, so many things where it's really hard to keep track of what's good and what's bad. In terms of fleas and tick treatment and the wormers, that's a big topic as well. Like, some people sit in the camp of, you know, don't give it to them at all. We want natural. Some people sit in the camp of get it from your vets, and then there's off the shelf. What's your take?
Oh, my take, I'm very passionate about this. My advice would be do not buy flea or worm products off the shelf.
Yes.
And the reason for that is it's full of chemicals that aren't always properly tested. Yeah. It's also the stuff that you get from the vets is prescribed medication, tested medication, and it contains the active drug that's used to kill those worms and those fleas and ticks and things safely. Yeah. And some of those some of those drugs are in the off-the-shelf products, but at such small doses that they work.
Fine.
Because they're not allowed to have a certain amount of that drug in, because otherwise you need a prescription for that. Yeah. The safest route is to get everything from the vets and to actually regularly do it. There is talk about, you know, being natural and maybe they don't need it as much. If you're that concerned, you can ask your vets to have like a fecal test, and there's ways of checking fleas at home, which is something everyone can do at home. What you could do is get a piece of white paper. Okay. And then you like scratch your dog's bum and get all the dirt onto that paper. Yeah. And then if you add drops of water to that black dirt, you'll see it looks a bit like brown or red staining, and that's flea dirt.
Oh, okay. So that's a really good tip.
I like that tip, because then everybody can do it. It's not just you have to go to the vets to do that. But when you establish that that's what you've got, absolutely do it. In terms of worming's super important.
Yes, it is.
What I have seen a lot in my career is the effect of lungworm when it's not treated. So lungworm is found, you'll see the adverts everywhere, like it goes through snails, and so any garden, anything they've licked in the garden, or a ball they've got that slug's gone across, they can ingest it that way. And what happens is it ends up getting into the lungs, and the lungworm grows, and then you have like worms filled their lungs, and they die.
Oh my gosh.
So you can see symptoms like coughing, but sometimes, and a lot of the time, you do not know that they've got it, because some of it's so well hidden that they don't have clinical symptoms.
Oh wow.
So when sometimes we found that if we have a dog coming in to be neutered, we've noticed when we're doing the procedure that their blood isn't clotting properly, which is obviously dangerous. They need it to clot so that they can survive. Yeah. And when we come across something like that, we will always do a quick lungworm test.
Fine. Okay.
That's the big killer.
Gosh. Okay. So top tip is wormer.
Yeah. From the vets.
From the vets, definitely. Okay. And then probably one of my favourite asks is anal glands.
Oh, I love doing anal glands.
Do you? Yeah. No way.
It's so weird.
But I've never heard that from someone's mouth. There we are. There we are.
Which, people like us guys in the vets like, oh, I've got an anal gland expression to do. Anyone want to do it? I'm like, I'll do it. I'm up in the office. I'll come down and do it. I love it. It's a bit like popping a spot. Like, get that, like, that's satisfying thing there. But yeah, signs to look for: scooting the bum, overly licking. You can feel from the outside, but you need to know what you're looking for. I know groomers empty anal glands too.
Some of
them.
think they're coming away from it as much.
Yeah. Because there's some, if you burst that anal glands or do something wrong with it, then it's veterinary treatments needed. And if you do not know what you're doing, I wouldn't recommend it, but you can definitely look out for the signs of it. And if it's a regular thing and you keep having to go to get them expressed, then it's usually good to add fibre to the diet.
Yes.
So either with added things, I know like you like the tip of adding vegetables, or someone's mentioned cooked vegetables, didn't they? Or you can buy a fibre product, which is a bit like a supplement that you just pour on the food. So that's a way you can prevent it at home.
Definitely. I feel like we're quite quick to express anal glands, but then you look at the dog's diet and you kind of go, well, it's not getting what it needs. So if you are unsure, I know vets can advise on diet, but they work with veterinary nutritionists, and I would say that's one thing I've learned recently is there is so much more to feeding than we know about. And so it's personalized for your dog, their allergies, their age, their environment. So definitely, again, as Roxy said, there is a cure, which is expressing them, but prevention is adding fibre.
Yeah, because you don't want to have to express them all the time. You can't live like that.
No.
So if you know you're having to do it really regularly, like we're having to do this all the time, let's make some changes so that it reduces the times that you're doing it. And most of the time, if you do the right diet and you're adding the right amount of fibre in, it
clears up.
It can clear up.
Because we're all about natural where possible.
Yeah.
But, that's us with our bodies as well, trying to be natural. But it's a hard one. So are there any other tips in terms of should we be getting I'm not very good at doing that for myself, like getting a health check. How often should we be doing that for our dog?
Definitely every year.
Okay.
With a vet. At the time of vaccination, it's ideal because they'll do a full health check for you at that point anyway. And now the new guidance and law is that when we prescribe flea and worm medication, they have to have a full health check with that as well.
Fine.
Which is good. But every vets will allow you to go and see a nurse, which is either cheaper or free. They do free nurse consults and things that we can do a once over with them as well. We can listen to their heart, check if there's any evidence of like heart murmurs. But in terms of how regular, at least once a year. When they're a puppy, they need to be seen probably a bit more in terms of like they need more regular worming treatment, more like the vaccinations, there's a couple of them, like there's all those kind of things, and socialization and things like that. Definitely every year as an adult. If you could do twice a year, that would be great. Even once a year with a vet and then seeing the nurse halfway through the year, and plus keeping your log at home with what's going on. And then when you get to geriatric stage, so most is like 8+. We call as geriatric.
The little senior dogs.
I would definitely advise when you go in for your annual checks, have a blood test at the same time.
Oh, okay.
Because
see, we don't get told these things as you learn, don't you? So that's a really good tip.
And that's me talking as a dog owner. Like when you're a grown adult and you're getting older, things start to fail, organs start to go downhill. Certain dogs usually get predisposed the conditions for certain things. So you'd like the Labradors and their hips and things and joints. But kidney and liver function is a really good indicator of how they're aging and how long we've got and things like that. If you know you've got some raised liver or liver enzymes, there's supplements, there's food changes that you can use to keep it at bay and manage it at home. So with kidney disease, pH and salt levels are very have to be lowered and changed and be very specific. And then it can help you get to the point where my dog's collapsed on the ground and it's got chronic kidney failure and it's too late. So being senior, doing a regular blood test and probably regular checks. But I'd say twice a year. If you want to be really thorough, twice a year should be enough to go and get a full checkup.
It's so useful because when they get to senior, I feel like there's a lot of stress on the puppy phase, but actually this senior world, and dogs are hopefully living longer. I don't know as humans are, but I know my veterinary scientist said we're seeing diseases that are a little bit different now, and sort of our historical diseases that are coming back from the way we're feeding and different bits like that. But we want them to live as long as they possibly could in the best case, and their welfare, and so yeah, it's really important. But again, there's stress on puppy, and we always start off well, but senior's really easy to go, well, they're just old.
Yeah, they're just a bit quiet than normal. They just don't want that walk. And whereas actually they might not want that walk because they're a bit stiff, and they might need some pain relief just to help them go through their arthritic stage, because arthritis is a massive thing, and it's not even about quantity of life, it's the quality, and knowing when to stop and knowing what we can do to make them pain-free.
Yes. And I don't think dogs actually tell us much about pain. They're very good at keeping it beneath. I mean, mine with the severe hip dysplasia you would have thought he was fine.
Yeah.
And it's so funny now because I look at dogs' hips and I'm like, oh, that one doesn't quite look like he's walking right.
Yeah.
Now that I'm really astute to it, but that's why going to you guys is so important, because when you're in it, you don't necessarily see that health-wise.
No, and the owners know their dog better than anyone.
Yeah.
And just like Hitton mentioned hip dysplasia, we could notice it from maybe just they sat down a certain way. They sit down a bit of an angle, and that could be enough to go, oh, keep an eye on that.
Yeah.
But someone that isn't veterinary wouldn't ever think to look that far ahead. And it's about, the clients know, the owners know their dog better than anyone. So all those subtle little changes in their life is really important information.
Yeah. Yeah. Well, that's amazing. Thank you so much. And thanks for coming on the sofa to talk to me all about dogs.
It's been really fun.
I love it.
I could talk about dogs all day. I love it.
There's definitely some useful tips that we don't get told and we have to navigate. And also Google and ChatGPT and AI, it can be overwhelming. So coming from a human is so great, because it's kind of you're as a dog owner as well as a professional.
Yeah.
And knowing those little things is definitely something that we can all take away and do and fit into our busy lives and routines. So thank you.
Thank you very much for having me.